These are the medieval doctors, a strange and fascinating collection of monks, barbers, herbalists, and university scholars who fought disease with leeches, astrology, and live chickens strapped to the body. For roughly 1,000 years, from the fall of Rome to the dawn of the Renaissance, these were the people standing between you and death. And the truth is, some of them were far more capable than we give them credit for. Start with a number that puts everything into perspective. Average life expectancy in medieval Europe hovered between 30 and 35 years. 1 in every 5 children died at birth. Disease was everywhere, hygiene was minimal, and the medical knowledge available was a strange cocktail of ancient Greek philosophy, religious doctrine, and folk tradition. The dominant theory of illness wasn't germ theory, it was miasma theory. The belief that disease spread through corrupted, poisonous air rising from rotting matter and swamps. Against that backdrop, the question isn't just who these medieval doctors were. The real question is how anyone survived at all. The answer begins in the monasteries. During the early medieval centuries, monks were the primary custodians of medical knowledge in Europe, copying out manuscripts of Hippocrates and Galen by candlelight, preserving texts that would have otherwise been lost to history. Every monastery maintained an infirmary for its sick and aging members, and many extended care to the poor, to pilgrims, and to travelers who passed through. Some monks grew so skilled as healers that their reputation spread far beyond their walls, drawing patients from the surrounding countryside. By the height of the Middle Ages, England alone had roughly 1,000 monasteries serving a total population of just 2 to 3 million people, one monastery for every 2 to 3,000 souls. And alongside those monastic infirmaries, 500 purpose-built hospitals operated across medieval England. But that's where things get complicated. In 1163, a papal decree forbade monks from shedding blood. The Fourth Lateran Council reinforced this in 1215, explicitly prohibiting clergy from performing surgical procedures. The Church's position was clear: spiritual men should not be cutting into flesh. So if monks couldn't do surgery, who would? Enter the barber surgeons. First recognized around the year 1000, barber surgeons were the medical and grooming experts of medieval Europe, and they used both their razors and their dexterity to remarkable effect. One day, a barber surgeon might trim your hair. The next day, he might amputate your leg. They pulled teeth, performed bloodletting, lanced boils, and treated battlefield wounds, sometimes using cauterization, searing wounds with heated irons to stop bleeding and prevent infection. Their legacy is hiding in plain sight on every street corner. The barber's pole, with its red and white stripes, dates directly back to this era. The red represents blood, the white represents bandages, and the pole itself symbolizes the staff that patients gripped while a procedure was carried out. Guilds formalized this profession in France in 1210 and in England in 1308, and remarkably, archaeological evidence shows that many of their patients survived. Skeletons from the period reveal broken bones that healed perfectly, suggesting that medieval surgical care, while crude by modern standards, was more effective than we tend to assume. Alongside the barber surgeons, apothecaries formed another essential tier of medieval medicine, mixing remedies, dispensing herbs, and advising patients who could not afford a university-trained physician. Between the monks, the barber surgeons, and the apothecaries, medieval communities had more layers of medical care than popular history tends to acknowledge. Above them all, in the medical hierarchy sat the university-trained physicians, the elite of medieval medicine, and becoming one was no small feat. At the University of Montpellier, a student with a Master of Arts degree undertook 5 years of medical study, followed by 8 months of supervised practice. At Bologna, students completed 3 years studying the stars and planets because astrology was considered essential to medicine, then 4 more years of medical study, plus 3 additional years of philosophy. Getting licensed could consume the better part of a decade. What these medieval physicians actually learned traced back almost entirely to one fundamental idea: humoral theory. Inherited from the Greeks and refined by the Roman physician Galen, this system, formerly known as humorism, held that the human body contained 4 essential fluids: blood, phlegm, yellow bile, and black bile, and that health meant keeping them in balance. An excess of blood made you sanguine. Too much black bile made you melancholic. Diagnosis was an art of observation. Physicians felt the pulse, examined the skin, listened to the patient's story, and above all, they studied urine. Urine inspection was so central to medieval medicine that the urine flask became the very symbol of the doctor, depicted in manuscripts across Europe. The most important medical textbook in medieval Europe, though, wasn't written by a European at all. It was written by a Persian. Avicenna, known in the Islamic world as Ibn Sina, completed his masterwork, the Canon of Medicine, around the year 1025. This massive encyclopedia synthesized Greek, Indian, and Muslim medical knowledge into a single comprehensive system. Translated into Latin, it became the standard medical textbook across European universities and remained in use for centuries. During the 15th and 16th centuries alone, it was published more than 35 times, and a key figure in making that happen was Gerard of Cremona, the prolific 12th century translator who rendered the canon and dozens of other Arabic scientific texts into Latin, and who is arguably one of the most important intellectual bridges in the history of medicine. Avicenna was just one figure among many. Western doctors first encountered the works of Hippocrates and Galen, not through the original Greek, but through Arabic translations. Geoffrey Chaucer, writing his Canterbury Tales in the 14th century, name-dropped Islamic physicians as medical authorities. The debt that Western medicine owes to the medieval Muslim world is enormous, and it remains largely unrecognized. Within this world dominated by men, there were women who practiced medicine, and their story is one of the most compelling chapters of the period. At the School of Salerno in southern Italy, founded in the 9th century and remarkably free of church control, women were permitted to study medicine. In the 12th century, while women across Europe were denied education, Salerno trained them as physicians. Trotta of Salerno, often called Trotula, ran a prolific clinical practice and taught her students to diagnose illness using urine analysis, pulse rate, and skin tone evaluation. Hildegard of Bingen, born in 1098, entered a monastery at 14 and went on to write Causae et Curae, a medical text covering diagnosis, treatment, and prognosis for a wide range of diseases. The School of Salerno also produced the Regimen Sanitatis Salernitanum, a widely circulated health guide that brought practical medical advice to a broader European audience. These women were skilled, knowledgeable, and effective. The only real difference between them and their male counterparts was access. Women couldn't enter most universities or obtain medical licenses, so much of their healing work unfolded in homes and villages, invisible to the official record. And then came the ultimate test of medieval medicine. The Black Death arrived in Europe in 1347, and it broke the system entirely. Physicians tried everything. Bloodletting to restore humoral balance, though it only weakened dying patients further. Theriac, also known as Venice treacle, an ancient compound that, thanks to its opium content, may have actually eased some symptoms. And the Vicary method, in which a live chicken was plucked clean and strapped to the patient's swollen lymph nodes to supposedly draw out the disease. Guy de Chauliac, later called the father of Western surgery, worked tirelessly through the epidemic and left behind a chilling account. The plague was so contagious, he wrote, especially the pneumonic form, that people caught it not just from close contact but seemingly from simply looking at the sick. In the century and a half that followed, more than 280 plague treatises would be written across Europe, a torrent of desperate scholarship from medieval doctors trying to make sense of a disease they couldn't explain. The toll on physicians was staggering. In Venice, of 18 doctors practicing before the plague, only one remained by 1348. 5 had died, 12 had fled. A prominent Italian physician named Gentile da Foligno, famous for treating plague patients, died of the disease himself that same year. The public criticized doctors for fleeing, for greed, and for their helplessness. But many stayed and died alongside their patients. One lasting innovation did emerge from the catastrophe. The port city of Ragusa, modern-day Dubrovnik, imposed a 30-day isolation period on arriving ships. Other cities adopted the practice and extended it to 40 days, the quarantino, which gives English its word quarantine. And here's one final detail that might surprise you. That iconic plague doctor costume, the long black robe and beaked mask stuffed with herbs, the image that dominates every Halloween store and history meme, it didn't exist during the Black Death. The first mention of that costume comes from a 1619 outbreak in Paris, nearly 3 centuries later. The doctors of the Middle Ages were not the ignorant charlatans of popular imagination. They worked within the limits of what their world understood, drawing on traditions that stretched back thousands of years, doing their best against diseases they couldn't see, couldn't explain, and couldn't cure. Medieval medicine, for all its strangeness, was a living system, constantly absorbing, translating, and building on everything that came before it. And in the process, these medieval doctors built the foundations that modern medicine would eventually rise upon.